This is Heart Rhythm TV. I'm Deepthy Varghese. Today's episode takes us beyond the cath lab into communities where access to electrophysiology care is limited, but the passion to save lives is limitless. Meet the team behind the Scheinman Foundation, Jena Humer and Dr. Pichmanil. Welcome. Give us a picture. What does cardiac rhythm care look like in some of the regions that you've served in?
So we're currently serving in Southeast Asia, which is where we've been working with Dr. Manil over the last 10 years. And so when we started coming to Cambodia, they didn't have any EP care in Cambodia. So we brought over a mapping system and started to begin training Dr. Manil on EP. If you needed a pacemaker at that time, you had to go to Thailand or Singapore to seek care. So over the last 10 years, we've really been able to make great improvements. Over the last year, they have 3D mapping now available and even able to implant the first leadless pacemaker, the Micra, 2 years ago. So very exciting.
Yeah, that's very exciting and innovative. For those watching, what are some ways that people can get involved or support your foundation?
We're always looking for more volunteers. We take typically about 15 people to Cambodia and Vietnam every year. So you certainly can go to the website and say that you're interested in joining, and someone from the team will reach out to get to know more about your background and where we think you might fit best. But obviously we also need monetary donations. To fund a fellow costs about $70,000. So we definitely need monetary donations to help continue this program.
What is on the horizon for this Scheinman Foundation? Any new initiatives or countries that you are hoping to reach?
Yes, we've been working primarily in Cambodia and Vietnam over the last 10 years, and we're looking to expand into Africa. There's 60 million people that don't have access to EP care, so we're hoping that we can start our initiatives there and grow there. We're going to be going to Tanzania in July to start to see what we can do.
That's amazing. Dr. Manil, you were once a student, now you're a teacher. What was it like going from being trained by the Scheinman Foundation to now leading an effort to train other EPs in Cambodia? Tell us about your experience.
So I think it's a very long story, and I should take it very quick summary for a story between me and the foundation. Mm-hmm. So it has been around, I think, almost 10 years that I met a group of good people, I can say, and they come from United States. They did the medical missionary, and mostly they are EP doctor. And they have seen the patient, take care of the patient that's suffering from arrhythmia. And I was in cardiology resident at that time. So I think I was fascinated by their work. And the first thing that I can see is their inspiration that really push my motivations. I think the others, the residents, other people also amazed how they are sacrificed, flying from different regions, Australia, United States, Hong Kong, coming to help us, teaching how to do ablations. Mm-hmm. So it's very, very great experience for us. So after we build a relationship between the foundation and local resident and local doctor, I got supported from a foundation, Melvin Scheinman. Mm-hmm. That time, I think in 2020, mm-hmm. It was called the Melvin Scheinman Grant, mm-hmm. and in conjunction with a Korean Heart Rhythm Society that was called Wang Family Foundation. So I had a chance to go to Korea for 1 year training, mm-hmm. in EP, because we don't have official EP training yet. Mm-hmm. And after coming back to Cambodia, I have a chance. I can say I have a more experience in EP. I met a lot of EP doctor. I met Jena, who's a very amazing person that really taking care of the patient and also taking care all the people in the team. I can understand that. So when I come back to Korea, what I can say is my role is to make more EP doctor in Cambodia. So I think that the foundation really want to make it sustainability. So it is my responsible to continue this work in side of my country. So teaching resident, training medical student what is EP, showing to the general physician what is atrial fibrillation, what is important to treat, to prevention for that is important. I should to emphasize more on. I think so. Cambodia has several obstacles. I think it's the most developing country in Southeast Asia or in Asia Pacific region. They have like we lack of center, we lack of operator. Sometimes we lack of. I think it's not sometimes. I think it's, in my country after I become attending EP. I realized that a personal training is also important. Training the nurse to become a great EP team because EP, as you know, is need a lot of good people to become a good team, like a family, and we take care of the patient in the EP lab. So I also takes my time to train the nurse to become an EP nurse that dedicated to arrhythmic care. So those all of works need the efforts, but it's very satisfaction for me to continue kind of this work for me.
Wow, what an incredible experience. Thank you both for sharing your insights and giving us a glimpse into the incredible things that's being done by the Scheinman Foundation.
Yeah.
Stay
Thank you.
tuned for more content from Heart Rhythm TV.